Hi guys, my name is Leanne Hinojosa, and my presentation is cardiac rehab patients and depression. So I think this is really interesting about cardiac rehab patients because, they have these life-changing events that happen to them, and there's some patients who react very positive to them, and there's some that react very negative. So, I think it's really difficult for something to happen to you and your whole life changes after that. So, it's really interesting to research the kind of things that happen. And depression was probably one of the most things that was more prevalent in this population of people. Um, so, I really just want to talk to y'all about this, and I can't wait. Alrighty, next slide. So, here's my outline that's give you a little heads up what I'm going to talk about. I'm going to talk about cardiovascular disease introduction, give you a little bit of that. I'm going to talk to you about acute coronary syndrome and congestive heart failure, which kind of, both those are very prevalent in cardiac rehab patients. Some of them get stents and their heart failure and all this. So I would talk to you about those. And then I would talk about cardiac rehab, basically the phases, the core components, the goals and everything, because there's a lot to it than you might think there is. And so I'm going to talk about the issues, and I'm also going to talk to you about depression in patients. All right. So cardiovascular disease, CVD, is made of coronary heart disease, heart failure, hypertension, and stroke. This represents the leading cause of death in the United States. So, we all do know someone who's had a heart event in their life. And it's very expensive also. The estimated cost of diseases of the heart were $177.5 billion in 2007. And it's probably increased since then. Heart disease is probably one of the things that just keeps growing and growing each year, because due to the fact of fast food and, the very sedentary lifestyle that people live these days. We encourage people to go outside and exercise every day, do something, so we won't have to suffer from these kinds of conditions. But every minute an American will die of a coronary event. Sorry. So it's very, very prevalent. We know at least someone, uh, maybe not in our family, but someone that we know that has been affected by this. So acute coronary syndromes are basically unstable angina, which are chest pains, and acute myocardial infarction, which is a heart attack. So basically, this is just a result of atherosclerotic plaque development in the artery. And so you can see here, this is the artery, and you can see the blood flow trying to flow, but it's blocked by this plaque that's in this artery in the walls. And sometimes when this artery gets blocked too much, it ruptures, or it can form a blood clot. So, and this is what happens, and that's how chest pain and heart attack happen. And it's a very painful thing. People say it's, what's happening, and it's just one of those things that we just try to prevent so much with a healthy lifestyle, definitely. And so, what causes atherosclerosis? So many things. There's tobacco use, dyslipidemia, hypertension, living a sedentary lifestyle, obesity, diabetes mellitus, metabolic syndrome, family history. If it runs in your family, it's very genetic. If you're a male, it's more prevalent. Obstructive sleep apnea and psychological factors. So, we try to prevent, atherosclerosis. You can just eating right and living a good lifestyle. We really, really prevent this. And so treatments, there's obviously so many other treatments out there to cure or to help acute coronary syndrome. But the ones that we see in cardiac rehab usually go through reperfusion therapy. So the reperfusion therapy is basically this angioplasty, is basically percutaneous transluminal coronary angioplasty, which basically is a stent that gets inserted in your artery. And if you can see here in this picture right here, the artery is being widened, so the blood flow can actually flow, faster and, more efficiently. A lot of patients say, like, the day after they get out of the surgery, they say they feel so well. They feel, they feel like a brand new person, which is, because blood is actually flowing correctly now. And this is kind of one of the factors that they don't want to do, cardiac rehab, just the fact that, like, they feel so good, but that they get used to it after a while. And so we do still recommend exercise therapy for these patients who get this kind of surgery. And then we also have a coronary artery bypass, which is basically revascularization by using a venous graft from an arm, leg, or an arterial graft. And basically, if you see in this picture here, they're using a leg graft. So, and they're inserting it over here, and this one that's connected to this is the graft. And basically, it's kind of just one of those, another alternative for blood flow. It's very interesting procedure. So these are the treatments, and kind of one of the most popular ones in cardiac rehab, definitely. So we have important information. Advances in coronary revascularization procedures in an aging population have led to a greater number of patients presenting for rehab following CABS and PTCA with or without stenting. And another interesting fact is that cardiac rehab begins as soon as possible after surgery. So back in the old days, a lot of doctors would really prescribe bed rest to these patients. But these patients, we have found out that, exercise immediately after surgery is so much more beneficial. And, it makes sense. You don't want to lay in bed for so long because it doesn't help you. It doesn't make your heart stronger. You want to put stress on the heart so it can become stronger and work the way it used to. Shorter hospital stays have changed the inpatient program to basic range of motion exercises and ambulation. And education focuses on medications, home activities, and follow-up appointments. Definitely. So cardiovascular disease. So we're also going to talk about congestive heart failure. So as you can see here in the picture images, this is a normal heart, working heart. And then you see problems like you see this, the difference between this muscle of wall and this one. So yeah, less blood is pumped out of the ventricles. And so the weakened heart muscle can't squeeze as well. So that really, really inhibits the heart from working the way it's supposed to, and which also can produce, heart failure. Another type of heart failure is when this muscle right here is way too thick, and the less blood fills the ventricles. So the heart becomes stiff, and the muscle can't relax normally. So it's kind of always stressed, which we really don't want that to happen. It's never really relaxed. So congestive heart failure is the inability of the left ventricle to pump blood at a level that is to compensate for metabolic needs. This can be due to, either systolic or diastolic, we just talked about. Heart failure causes water to leak out of your blood vessels. This water can fill up your lungs and make your legs swell, which is not good. It's one of those things where very, very dangerous. And so another interesting fact of congestive heart failure is that it's today's fastest growing cardiac related diagnosis. So this is happening very, very often. And, also, current research established that among eligible patients with stable heart failure, regular exercise improves exercise tolerance and quality of life. So as well as moderately reduces the risk for all cause of death or hospitalization, cardiovascular death, or HF hospitalization. So, exercise does really well with this kind of heart failure. So it's really important for them to start exercising and getting back at it. So like we just kind of discussed, it's very, very prevalent. 5.7 million are afflicted, sorry. And it's usually in the older population, 65 years older. 45 years is kind of a little young for this, having heart failure, but, new cases are coming up and the younger people are getting it. It's kind of scary because, at age 40, your heart should still be, functioning well and everything. So this is really due to self-inflicted treatments. So treatments are very interesting. We have lifestyle treatments. We have lifestyle changes, risk factor management. You're going to have to change your whole life when you get, chronic heart failure. You have to stop smoking, you have to manage your weight and control your diabetes. And that's the thing, when people have these kinds of, have heart disease, it's usually associated with other things like arthritis, diabetes, things like that. So it's a whole life change, it's a change for the better though, definitely. So we also do have food restriction, exercise therapy, which is aka cardiac rehab. We have also medical therapy, device therapy, and surgical therapy. And here is a video of cardiac rehab. Very interesting. And let me get this working.
Last April, 56-year-old John Hughes got up, got dressed, and went to work. It seemed like any other day, but that day was going to change his life.
These pains just came out of nowhere. I was sitting down at my desk at work, like on a typical day when it first started happening. I didn't know what it was. I thought it was like an anxiety attack or something. And it went away. And then a few hours later, I was walking home and it came back.
John was having a heart attack.
How long did it take? You said 10 days to get to the hospital?
Yeah. I started having the pains and hoped they would go away, and then they didn't. I went to the doctor on a Wednesday. I was in the hospital the next day at 4 o'clock.
And by that evening, his doctors had put a stent in his heart to clear a blocked artery. But John's story doesn't end there.
Okay with you feeling a little short of breath, a little fatigued, as long as you're able to answer my questions and carry on a conversation. I don't want you to be gasping, but right. Your body has to get yourself used to it.
The surgery was over, but the hard work was just beginning. John's doctors sent him to cardiac rehabilitation.
So everyone gets designed a program for them. It's no out-of-the-box settings. So we assess them to see where their functional capacity is and where they're going to begin. I write an exercise program based on that assessment. They get evaluated by staff members to see if there's any other limitations that might prohibit them from participating, or we might need to alter certain equipment use, whether they have a bad arthritis, or sometimes people actually just don't walk correctly and they need to just relearn a little bit and then they can walk better on the treadmill.
An average visit to rehab is 36 sessions, going 3 times a week over a 12-week period.
Doctors at Mount Sinai Beth Israel say one of the reasons for rehabilitation is to give patients an exercise routine to get them back to the health they were before their surgery and prevent future health problems.
The studies have shown, regardless whether or not you just had a simple stent and you were going back versus something which seems more significant, a heart attack or open heart surgery, the recommendations really are everyone should undergo cardiac rehabilitation.
188.78.
And I did not want to do this. I was like, no, I don't need to do this. I was trying to talk my doctor out of it. Finally she was like, just do the stress test and see how it goes. Which when I took the stress test, I was like 3 minutes into like a 12-minute test. And they had to stop the test because my blood pressure went up over 200. And, that's dangerous.
Patients are monitored closely and their blood pressure measured to track their progress. The ultimate goal is to have them on an exercise routine that they can safely keep up after surgery. But cardiac rehab is not just for their physical health.
So when people do suffer a cardiac event, it can be quite a shock to the body. It's an adjustment to their quality of life sometimes, and it can be quite significant. Or be told if you're a young person that you need open heart surgery. So depression plays a strong role in your overall health. And what exercise does, first thing, it helps people realize that their life isn't over, but also exercise overall helps release endorphins, and just improves overall mind-body health.
And John knows that best.
I absolutely feel better. There's no question about it.
Holly for
Alrighty, and so now you can see, what cardiac rehab, kind of like a glimpse of it. Um, and like I said, it's a changing philosophy. Basically, back in 1850, in initial activity, was kind of like, go for a walk or do, was often removed by gymnastics or, some kind of thing like that. And then we got to 1940 where bed rest was, doctors recommended, no activity and just wanted just do nothing. And that's kind of like one of the things. And so things started changing as around, the chair treatment, exercise, not too aggressive, not too hard. And so we kind of get up, we start progressing a little bit until we reached 2008, which, the Pulmonary and Cardiac Rehab Act is in place. And we got to, understand that physical activity is so important for these patients and to get the heart going again, definitely. So now we're getting to cardiac rehab, and it is a comprehensive exercise, education, and body and behavior modification program designed to improve the physical and emotional condition of patients with heart disease. Prescribed to control symptoms and improve exercise tolerance and improve overall quality of life. So, we're just trying to improve life and through exercise. The primary goal of the cardiac rehab is to enable the participant to achieve his or her optimal physical, psychological, social, and vocational functioning through exercise training and lifestyle change. So cardiac rehab is a very life-changing event. It's a very, a lot of things you're going to be working your butt off, and it's going to be really hard, but it's really, really worth it. And let's see, core components. So some of the main things that go into cardiac rehab are prescribed exercise to improve cardiovascular fitness. So we really want to, you'll see treadmills in there, you'll see VO2 maxes maybe getting done, without, and of course we're doing things in a very safe limit. We're not going to kill people because, these people's hearts are very fragile, and so we want to work up to becoming better and walking more and walking, efficiently. And we also do give education about the heart disease along with counseling other ways to stabilize or reverse heart disease by improving risk factors. And I think that's important. It's all about the education. We teach people about this, and we teach them about what they have. It's really important to know what kind of condition you have. And anyway, we want to really eliminate smoking. Smoking is probably one of the worst things you can do while being in cardiac rehab. Very, very damaging. Lipid management, basically fat management. We really want to control, our weight, definitely. Want to control the fat, definitely. Controlling high blood pressure definitely is another important one. Along with heart disease, there's so many different, associated factors. Like I just said earlier, people can have, arthritis. They can have so many other things, diabetes, and due to being overweight, you can and everything. So weight loss is very important. So diabetes, improving management diabetes, it's kind of one of those hand-in-hand things we think. So that's why you'll see it often. Increasing physical activity, definitely we want to be able to move and do regular things around our house. We do encourage healthy eating habits, which is kind of the hardest part to control because, you know, the patient's only in the cardiac rehab for about an hour every 3 weeks. So we can't really, people can't really, cardio rehab specialists can't really monitor what they eat. So they have to, that's kind of where the patient's responsibility comes into play. And then we also want to improve psychological well-being because, like, what this whole presentation about is about depression. It's about anxiety too. You know, these people, they get in, they have like, let's say they have a heart attack and they never felt like this would ever happen to them. And when it does, you're scared. I would be scared if, and it's one of those things where they have a lot of anxiety. They don't want to hurt themselves. And I can see why cardiac rehab can be kind of scary in a way, but it's one of those things that's been proven to be so beneficial. Okay, so now we're going to go into the cardiac rehab phases. There's 3 phases, and so the first phase is inpatient. So the phase 1 takes place in the hospital right after you experience a heart attack or other major heart problems. Phase 1 of cardiac rehab usually includes identifying which daily activities, such lifting as you do, something that you really want to do. What's your favorite sport? They really want to learn about you. They want to learn what you do, and they want to learn about your family education, about lifestyle changes you need to make, such as eating healthy, stop smoking. Changes your diet may be difficult to make, but even small changes can help improve cholesterol levels and improve your health. So phase 1 is kind of important, getting to really know your rehab specialist, definitely. The one thing that they want to do is they want to make you feel comfortable. There's a lot of people who are intimidated by a medical, personnel, and it's really hard because these people can be very intimidating, and a lot of them stereotypical come out as very judgmental. But I think cardiac rehab is a very passionate field, and I feel like they want to do is to help you. They don't want to judge you, and they want to make you feel as comfortable as possible, because that's one way it's just, they can work together. They really want to work with you. So cardiac rehab phases. So the phase 2 is the outpatient. And the core components are baseline patient assessment. So they will put you on a treadmill. They'll see how fast you can walk, or far, really. They want to see how long, what you can handle. They don't want to just put you on a treadmill and test a VO2 max and your max capacity. I don't think they would ever do that, but definitely want to do a baseline. It's important. Nutritional counseling, they really emphasize the meal placements and all kinds of things you need to eat. Risk factor management, lipids, hypertension, weight, diabetes, smoking. They want to really, this is when arthritis comes into play. They really want to help you improve that, your weight and everything else. And so they also do want to manage your psychosocial management. They want you to, you're going to meet people. It's a group, in physical activity counseling. They want to give you because people really don't know. You'd be surprised the people that don't know about physical activity. Parking the furthest away from a parking lot, while you're grocery storing, it could be counted as physical activity. That's just little things you can do to get, a good workout in. And exercise training also, definitely. So there's an education component as well. Education will increase your awareness of coronary disease. Its causes, prevention, and treatment, classes are incorporated into the scheduled sessions. So you'll be learning a lot about, your disease and about how your life is going to be. And I think that's really important to know and understand what you have and everything. So the exercise component, phase 2, helps you develop a regular heart strengthening exercise routine. So exercise programs are individually tailored and may include the following equipment. You'll be using treadmills, bicycles, arm ergometer, hand weights, and participants will attend sessions 3 times a week, 1 hour, up to 36 sessions. So this component is very important. It's kind of the main, thing in phase 2. The cost, the insurance does cover. Fortunately, it does cover this, this part of cardiac rehab, and most insurance, health maintenance organizations, and government reimbursement plans will cover up to 80% of program costs. And this is probably one of the most important things because, as far as medical things go, it's very expensive in the medical field. Any kind of procedures and rehabs are very expensive. So this helps low income and very, low income families participate in cardiac rehab. They want to give everybody a chance to get better and not go in for another surgery. Because I think that's one thing that these cardiac rehab specialists fear is you relapsing and getting another heart surgery or doing something else that's going to hurt you. They want to make you feel a lot better and they want you to be normal, be a healthy, active person again. Okay, so now we have phase 3, the outpatient. So basically, this is one of the hardest phases to ever get people to come back. Because this has, basically, the exercise component consists of exercise programs that are individually tailored and may include the following equipment. It can be treadmills, it's kind of the same thing, but this is kind of a self-pay program, and this is kind of not required. Participants will attend sessions 3 times a week for 1 hour. It's kind of the same thing as phase 2, but insurance doesn't cover this. And phase 3 is available to recent phase 2 graduates who have not met their prescribed exercise functional capacity, or by physician referral, or for patients who meet risk stratification. So basically, this is kind of a voluntary aspect of phase 3 of cardiac rehab, And it's one of those things where why people don't come back. And that's kind of one of the questions I ask later in my presentation. But, it can due to money. It can be expensive. I do know at Scott and White, they do charge $150 a day. That's an expensive gym. There's some places who you probably don't even pay $150 in 2 months. So, phase 3 is so important because it's kind of, you're changing your lifestyle and you want to get this into a daily thing. And, you don't have to be going for the rest of your life. I think, if you pay $150 3 times a week, that can be very, very expensive. So I think it's kind of, every once a week, it's kind of one of those, you can go and then kind of understand get really grasp the understanding of this lifestyle, and so you can do it on your own, definitely. So ACC and AHA guideline recommendations, referrals to cardiac rehab. So basically, the type of patients that we see are basically, myocardial infarctions, percutaneous coronary intervention, coronary artery bypass grafting, heart valve replacement repair, chronic stable angina plus stress, congestive heart failure, and left ventricular assisted device, and LVAD, and a heart transplant. So these are the kind of the people who get recommended to cardiac rehab. So the benefits of cardiac rehab are substantial. There's so many evidence that you know, cardiac rehab is so beneficial to people, and, it decreases mortality up to 5 years post participation. It makes you live longer, and it decreases cardiovascular events. You're less likely to have another heart attack if you do go through cardiac rehab. It improves modifiable risk factors. So, you have hypertension that goes down, weight goes down, um, cholesterol goes down. It's amazing what cardiac rehab can do. Improves adherence and preventive medications. So, adherence, that's what we really want people to start going. And as people start cardiac rehab, once they start coming once or twice, they'll come every day, especially if they start missing a couple in the beginning, they'll start coming. And then improves function and exercise capacity. Like we just saw with Mr. Hughes. He was very skeptical about it. He didn't want to do cardiac rehab, but he's at the end of the interview, he was glad he did it. He says he feels better than ever, and I think that's what cardiac rehab specialists want. They want you to feel better. They want you to go back to your normal life. They don't want you to be in bed and struggling. Definitely. And it improves the quality of life. It improves ability to return to leisure activities. It's really interesting because, most of these older parents, they want to be able to play with their grandchildren. I think that's one of the motivations that they have. I want to be able to lift my grandchild up. That's what most of them say. I want to be there. I want to go to their soccer games. I want to do things. And I think that's important to understand, for them to understand, is that, and it's really good to have family, that pushes them and everything. So, barriers of coming to cardiac rehab. So there are barriers, very, very things that restrict people. There's individual barriers, negative views and reactions to health service. Most of them are very scared of hospitals and very intimidated. They also feel like they're judged. A lot of doctors judge, and they don't want to feel that way. But again, rehab specialists don't want you to do rehab. They want to make you feel as comfortable as possible. So I think it's important for them to understand that very much. And so we have views and reactions to heart disease. So a lot of people, like I said, they never thought that they'd ever experience a heart attack. They always thought, oh, that can never happen to me. But it does happen to them. And they're very shocked. They're scared. And that's very, very normal to react. And so we have contextual barriers, which is distance and transportation issues. It's hard to get to a hospital. Scott and White, here at Scott and White and Temple, they have patients that live in the country and that they have to travel, and sometimes they can't travel to places, and they can't travel to the hospital, and they're older and they are not able to drive and everything, so that can be a really big barrier. Lack of family support. Yes. So this is, one thing that's kind of interesting, is older people, their family probably don't live there with them, and they feel like they're doing it alone. I think that's what most people, have a problem with it. And it's all about supporting, if you have your grandkids, your children, supporting them, it also gives them a very good motivation too. Gender roles and ethnicities also do play a barrier. Women are less likely to be in cardiac rehab than men, due to the fact that women just are very, they don't want to be the center of attention. They don't want to feel like a bother to people, especially in their family, who have to take them to their cardiac rehab sessions and everything. So I think women do, I think that's just being, a mom. A mom is used to taking care of everybody else, and when people want to take care of her, it's different, and she doesn't want to be taken care of. She wants to take care of people. And I think a lot of moms are like that. But women, you know, they do make an appearance, but again, like I said, it's gender roles and ethnicities are very different. And